A very good morning to you all, ladies and gentlemen. Yes. I saw you admiring the photos on the wall, sir. Professor George Makoha, Cabinet Secretary, Ministry of Education, Karibu sana. Maureen Mbaka, the Chief Administrative Secretary, ICT, Karibuni sana. Vice Chancellor, Professor Kiamagitai, welcome, sir. And of course, this College of Health Sciences Principal, James Mashoki, thank you so much for coming. Dr. Patrick Moth should be joining us very shortly. I see Dr. Lois Bacho over here. That's the reason why I'm here today. You've seen her on my show many times talking about this horrific pandemic we've had the last 14 months. And what you don't know is that most of the times I call Dr. Lois Mbacho, it's literally the last minute because I know you people are so busy. Literally, she's in meetings, she's in the lab, she's in all kinds of places. Last minute, and she always agrees, has never failed me. So when she called me and told me about the launch of SEMA, and we're keeping it as SEMA, not SEMA, we'll tell you why. The reason she called, when she called me, I said, there's no way I was going to let her down. So thank you, Dr. Lois. And she always insists that I use her titles: Head of Infectious Diseases at Kenyatta National Hospital and Senior Lecturer, University of Nairobi. Well done. Oh, Ila MBS. So welcome, everybody. Welcome to this great launch. It's going to be a fantastic event. Thank you for making time. We're going to take you through the program. There'll be a few introductory remarks, and then there'll be a short documentary, which will direct you to the two screens in front of you. After that, we'll have a quick panel discussion, and then an address by Dr. Moth. And then we go and launch SEMA. SEMA being the Center for Epidemiological Modeling and Analysis. So without further ado, oh, by the way, we are going live. By the way, we are live on YouTube at uonbi.ac.ke/live stream. Again, uonbi.ac.ke/live stream. Without further ado, please join me in welcoming to the stage the principal of the College of Health and Sciences here, Professor James Mashoki. Professor.
Thank you, Jeff. It's great to see you live. It's a great pleasure really for the college to host Jeff here and all of you invited for this very special occasion on this day, and therefore a very, very special welcome and recognition of our Cabinet Secretary, Minister of Education, Professor Magoha, who is a member of this college. He's one of our professors in urological sciences and urological surgery. It's always a pleasure. This place we are seated here courtesy of his principalship. He used to be the principal here. It's the one who made this place as it is, and the other floor, which is up here. So Professor Magoha, most welcome. Please, you deserve a round of applause as we start. Cabinet Secretary, ICT, represented by Maureen Mbaka, just gotten your name just now. Please welcome, also a round of applause, it's a pleasure. We are expecting the representative, the PS Minister of Health, the representative is on the way coming, Patrick Amoth. Directors, deans, and fellow academicians and researchers present here, distinguished guests, colleagues, ladies and gentlemen. Have we recognized our Vice Chancellor? Please, let's recognize our Vice Chancellor in a big way also. In a big way. Please, one more round of applause, please, for our Vice Chancellor. Ladies and gentlemen, this is a very, very special day for me. It's exciting. It is something which makes my heart beat faster than it should, because it's an occasion which demonstrates what this college is all about. This college, since its inception in 1967, it's about health, and it's about all that which pertains to health. We are known for partnerships. We are known for building capacities for health in this country. And one of the great partnerships we have, courtesy this, therefore, that which has made us be seated here today, is the partnership with Washington State University. Currently, at this college, we have got 4 faculty from Washington State University. It's a partnership. We signed an MOU way back in 1985. And at the moment in this college, ladies and gentlemen, we have got the following faculty from Washington State University, fully paid by Washington State University. To my right, Dr. Dombe Mwangi, please, Professor, can stand up for a round of applause. Professor Njenga Kariuki is not here. He's one of the renowned scientists. You have seen him being recognized many times. Currently, he wasn't able to join us. Dr. Eric Osoro and Dr. Sylvia Omulo. I don't know whether they have joined us today. Those are also, yes, Sylvia is there, please, from all the way, Washington State University. They are Kenyans, of course, but they're employed there fully, but they're working with us here in this college. Great researchers for that. They have partnered with one of our very own, Lois, please. The two of them, Dombe and Lois, have been working on this Center of Excellence as we sit here to launch it in epidemiological and modeling analysis, University of Nairobi. So they deserve a very special applause, the two of them. And so therefore, we are excited in the sense that out of the collaborations we are known for, this is happening. But also these collaborations come through individual efforts of our own colleagues here. And that's why, as always, and we have started this discussion on our CS and our Vice Chancellor, college is about people, it's about faculty and the staff in general, teaching staff and non-teaching staff. And the other partnership out of this, which soon we'll be calling you to launch, is one which is led by Timothy Barida. He's right at the corner there, from Accurate Health, which is part of a business partner of Siemens from Germany. And currently, Vice Chancellor and the CS, we are renovating the laboratories in the microbiology, immunology, and the pathology to the tune of 25 million US dollars over the next 5 years. I think we have spent a half of this money, Timothy, and we 25 million US dollars. Yes, so yes. So soon we'll be calling you to launch those laboratories. And these are the laboratories which will be a game changer in terms of research, in terms of clinical care, and in terms of providing services to Kenyans, particularly Kenyatta National Hospital. And we intend also to partner with the Ministry of Health, both central and the county government, to support those services at a very affordable cost. The University of Nairobi and the government, therefore, when a CS is present and the VC is spending no single cent in all this. The renovations are going on. We are hoping in the next 2 months, we'll be calling you to open those stream of laboratories. But also, and maybe during your time, CS, is the Center for Research, Innovation, and Grants Advancement, because we strongly believe we can only bridge the gap through grants, through scholarships, from our own staff, from our own faculty. And this is a center you remember very well in 2010 when you appointed me to lead through a grant from NIH. It's also another innovation which we'll be calling you to open. I think I didn't share with you, Professor Magoa, about it, and you kindly agreed that you'll be coming to open that center because it was started during your time. We're doing quite a lot in that center, and it's the one which supports all the grants which we do here. Currently also, we are partnering with many other institutions, just to mention HealthStrat, where we are working very closely with them to support the Ministry of Health through NASCO to train through the online platform, which again has been fully developed to the tune of almost 20 million Kenyan shillings through CDC, where we have close to 10,000 county health workers logged into it to learn around the tools on HIV/AIDS. So we have that also. It's a platform which is really ultra modern, as it were, which was developed through the support of US government. And so therefore, this is yet another first one. The Center for Epidemiological and Modeling Analysis, led by Sylvia and Dr. Dumbe. And as we launch it, we are grateful and we feel great about it. And we are very happy for that. Our Vice Chancellor has always been supporting us in all these endeavors. And even as we prepare to do a lot more through our staff, we know it is hand in terms of funds, finances. We know I've started discussions through my college management board on how can be supported, a special consideration with regard to retention of the many faculty whom we need to train and doctor and to do all what we are doing. We would want, it's not a 100-meter dash, it's a long journey. And we will be pleading and discussing with the leadership of the university and the ministry to see how we can be considered on a special way to retain a number of our professors whom we would want to continue working with us, because we need them, because of the law, particularly surgical disciplines require those most experienced. And therefore, we will be discussing that with yourselves. I felt I needed to mention that, as also we celebrate the launch of this also very important center of excellence, besides other centers of excellence, which will be launching as we move forward. And so therefore, distinguished guests, ladies and gentlemen, mine really, I do want to make a very long speech today because this day belongs to the CSs, belongs to our Vice Chancellor. And therefore, I want to request you to join me, distinguished guests, ladies and gentlemen, in inviting, as I invite our Vice Chancellor, Professor Stephen Kiama-Gitai, who has really given us tremendous support since I took over the office as the principal of this college, to make his remarks as we learn more about SEMA's achievements and vision for the future. Please join me to welcome him.
The CS Education, Professor George Magoha, who is very well familiar with the University of Nairobi, having served as Vice Chancellor in this university for the full term of 10 years. That's a long time, given the level of activity required for this office. Having served as a principal here, and therefore also very familiar with what is happening in this college, we welcome you back home. Let's clap as we receive him in the college. And we wish you very best as you continue serving the country at the level you are doing. I want to also acknowledge the Chief Administrative Secretary for ICT, Maureen Barker, for coming even to partner with us in this very, very important initiative. Pass our best regards to the CS. We believe that this issue of data, that your ministry will be very key in achieving what the university want to achieve. Asante sana, we expect the State Department of Health here. I don't know whether Modi is here already. And I want to acknowledge all the distinguished guests I have in this room, including our Jeff Konange, who we are always looking forward to watching news at JKL, you know. and Thumbi and Professor Thumbi, and then also Chieng for the work you have done. Ladies and gentlemen, I welcome you all to this important occasion for the launch of the Center for Epidemiological Modeling and Analysis, the CEMA. One of the 5 reform agendas that we are currently undertaking at the University of Nairobi is data-driven management, where decision-making is guided by data analytics. Data analytics helps decision makers to predict about the future with more accuracy. And more importantly, we believe that it provides organization with creative solutions to business problems without errors of human intervention. It gives organizations the ability to make informed decisions and ultimately plays an important role in driving organization business strategy. Our society continue to suffer from complex challenges that are intricately interwoven. The solution to such messy problems, like the experience from the current COVID-19 pandemic has shown, cannot be found through a single discipline, and data is necessary. Instead, they require a wide range of interventions and diverse expertise, working collaboratively to provide sustainable solutions. This launch of the Center of Epidemiological Modeling and Analysis, CEMA, is therefore a move in the right direction. The center will be a national resource that gives us the capacity to tackle some of the greatest societal and public health challenges of our time. The key focus of CEMA is to protect and improve the health of Kenyans and that of the continent by improving the speed and quality of decision-making in health aided by data. Welcome, Amoth. At the University of Nairobi, we have a rich wealth of expertise, ranging from infectious disease specialists, epidemiologists, mathematicians, statisticians, demographers, computer scientists, data scientists, and many others. CEMA brings together these experts from diverse disciplines to employ their skills and to make the best use of data in decision-making in health. There are enough reasons for us to prove beyond doubt that what we have always done based on intuition isn't the best way. At the University of Nairobi, CEMA has a close relationship with the Center for Health Informatics and Digital Health at the School of Computing, as well as other centers and institutes at the university focused on health and industry partners, such as Kuala, a digital innovation company. The University of Nairobi, through CEMA, is especially proud of the excellent collaboration it has developed with the Kenya's Ministry of Health. And thank you for coming. Sharing the common vision of a healthy, productive, and a globally competitive nation. During the pandemic, CEMA has played a critical role in the rapid analysis of COVID-19 data, clinical management of patients, and epidemiological projections that have guided the response to the pandemic within the country. And I know there has been quite a good contribution from this college to help in addressing the issue of the COVID-19 pandemic. And CS, I want to mention also something that was told to me. Somebody was sitting exams and then they fell down sometime on the COVID, and you had put down mechanisms of ensuring that even during exams, that these kids are taken care of and they sit for their exams. So that was really, really touching to know that you had gone at that detail in planning for the examination that was conducted recently. And this college also helped in guiding and giving the data that will help us predict what is there in the future. Our researchers at CEMA have worked closely with the scientists from the Kenya Medical Research Institutes and other centers, including Center for Disease and Prevention and Strathmore University in Kenya, among others, to form technical review team to provide a rapid peer review mechanism. At all the times of public health crisis where real-life decision-making is paramount, this technical review team has accorded an opportunity for different modeling groups within the country to exchange and enrich ideas bringing transparency and objectivity to modeling and analysis approaches. This has allowed a thorough scrutiny and identification of model assumptions, care in interpretation of model outputs, allowing the Ministry of Health and government to receive consensus messages, as well as uncertainties from different modeling outputs. The impact of this initiative has been that advisories on the best course of action and responses to the pandemic have been informed by data from well-thought analysis and not guesswork or simplistic mental model deficient of data insights. Colleagues, data is an incredible resource to catalyze the attainment of a healthy and a wealthy nation. SEMA is at the center of drawing insight from data to make the right decisions in health, to optimize resources for the best possible health outcome. The next phase of SEMA, therefore, is committed to 5 key focus areas. 1, applied epidemiological and mathematical modeling to address disease outbreaks and epidemics and the control and the elimination of infectious diseases. 2, clinical infectious diseases and antimicrobial resistance research to improve evidence gathering for prevention care and treatment to improve health outcomes. 3, health data infrastructure and the tools development for improving surveillance and response to public health events. Health data training hub to develop capacity for data analysis, applied epidemiological modeling, and translating data insights into policies that improve public health. And lastly, youth and women as a critical resource for the country that can help accelerating attainment of African health. At the University of Nairobi, we understand that prompt and rigorous analysis of good quality health data is key to understanding health need, designing health programs and policies, and guiding investments and public health decisions, and in measuring progress toward attaining equitable, affordable, accessible, and quality health care for all. SEMA has therefore come at a very, very appropriate time when the University of Nairobi is positioning itself for impact, even as it celebrates 50 years of existence. And the CS, you are part of one of the decades where you contributed also in your way, working with all of us. And now University of Nairobi is celebrating 50 years. And this SEMA comes in at the right time as we position for impact into the next 50 years and beyond. Today, as we launch SEMA, we must also applaud the government of Kenya through the Ministry of Health for the leadership in responding to the COVID-19 pandemic in the country. We particularly appreciate the Ministry of Health's role for bringing on board strong collaborative networks of other government agencies, including the Ministry of Information, Communication, Ministry of Education, and the Ministry of Interior and the coordination of national government. There is value for the society when policymakers work together with academia and the development partners in searching for permanent solution to the societal problems like pandemics. We are proud that the University of Nairobi has been at the forefront of providing such expertise, and we will continue to contribute to health of Kenyans and citizens of the world through expertise as demonstrated in this center we are launching today. Let me take this opportunity, ladies and gentlemen, to laud the contributions that professors from the University of Nairobi have provided during the COVID-19 pandemic and in the establishment of this center, SEMA, at the University of Nairobi. Allow me to recognize Professors Thombe Mwangi, who have just been recognized earlier, and Loisa Chieng Obanjo for their excellent leadership for steering this center. The University of Nairobi, and myself in particular, is committed to supporting SEMA to flourish as a center of excellence for data science on health in the region and to make a real impact in improving Africans' health. SEMA is one of its kind in the region. SEMA embodies the University of Nairobi spirit of research and innovation, a reputation for excellence, a strong and vibrant research culture, and a recognition for impact and relevance to the region. Thank you all for listening, and God bless you. I invite now I didn't check my program. I need to check here quickly. Yeah? the Ministry of Health, isn't it? Okay. Yes, you know. Yes, yeah, that's why I wanted to ensure that I do it correctly. Yes, it's really my very great pleasure to invite my colleague and the Cabinet Secretary for Education, Professor George Magoha, to give his remarks in this college, which he also considers his home. Welcome, Prof.
Let me be tribalistic and start with Jeff Koinange, whom I have not had the opportunity to address directly in the past. Jeff, you have a voice. I don't know where you got the voice from, but we are happy that it's a Kenyan voice. My colleague, the Chief Administrative Secretary, Maureen Baka, Acting Director General, Dr. Patrick Amoth. I will tell my colleague now that we are chairing a very important WHO consortium. That word acting should actually not be there. It is a national embarrassment. My colleague and friend, Professor Kiama Gitahi, Principal College of Health Sciences, Professor James Machuki, and Dr. Lois Ombajo. Everything you said about her is correct because I am a slave driver and I start work at 6 and I have done the same, and she has been available. And she has given me invaluable advice when I'm managing the population, which is basically in primary and secondary schools. That's why I escaped the wrath of those people. Colleagues, faculty members, men of letters, distinguished men of letters, members of the press, ladies and gentlemen. I'm actually at home, very much at home. I hope that I will complete the rest of my life in this institution. I also don't intend to work throughout, but I hope that if there's anything I can do for this college as faculty, it is extremely important because, you know, a professor, most people don't know what a professor means. But a professor is somebody who is so excellent in what he's doing that he professes it. So forget about the other professors who are making noise outside. Because now we have a Google Scholar platform. And anybody who is a professor should score there reasonably. If you are a professor and we are looking at your name and you're not there, you can't be a professor. And when a vice chancellor, I keep also pleading with you once again, that as long as a professor is productive, that productivity of the professor is what is actually going to attract the students for you. For example, when I come back here, you can be sure there will be people who come because I am there. But if you want me to go and rest, then those people will follow me where I'm going. It's important to listen to this because this university must survive. I was very deeply touched indeed. I'm not going to repeat what has been said. Excellent things about SEMA. I was very deeply touched by the address of the principal, where he said he is still getting research funds to help us to build this university. When I took over as Vice Chancellor in 2005, the research kitty was 350 million Kenya shilling. By the time I was leaving, it was 4.5 billion. When a principal, you have not told us whether it has increased or gone down, because it is squarely in your hands. And the university should be proud that if it is 6 billion, how much of that 6 billion are you giving to the Vice Chancellor to run the university? Because when you negotiate for these grants, the owners want to use all of them. But then the university must be there. And even though it's usually about 15%, in their own countries, they give up to 30%. Now, if you are not a fighter, or let me not use that word, if you are a gentleman, you go nowhere. Are you listening? Whether in London, Paris, or Washington, you cannot be a gentleman to get anything. You must actually demand and take. Do you get the point? Because the setup we have here in Kenya, especially in this university, this excellent college, you don't replicate it anywhere. So it is not like you are going to be competing with another. I remember when His Excellency the President took over in 2013, there was an East Africa-wide inspection of these institutions. And the College of Health Sciences was voted the best institution in this region. And I had the pleasure of going to receive that trophy together with His Excellency in Kampala. What has happened that another takataka somewhere you hear is now number one? What has happened? So you people have to really love this place the way it should be, because the way we have laid ground, there is no medical school that has strong faculty like here. There's no medical school that has strong faculty like here. Are we together? And the way you protect your faculty, look at the thematic areas. If it is endocrinology, no, let me take even my own field. Of course, I'll make noise that I'm still there, but am I really still there? Because at the very most, I can give 2 or 3 or 4 years. What is the succession plan that the university has made to ensure that as I leave, the knowledge is captured by somebody who is senior enough? Not whoever is available, a toddler who is available, is brought to the level and he can't manage. That will definitely bring the intellectual capability of this college down. So be bold enough to ensure that you are running excellent programs for tutorial fellows. Even if they're expensive, what is good is not cheap. Who has told you what is good is cheap? What is good is expensive. You take neurosurgery, for example, where I have a conflict of interest anyway, but still, there are senior people there. You look at them. Patrick Okoth was at school with me. Professor Mwangombe, in the same bracket. Dr. Musa, we were able to train him, but that was a long time ago, in 1988. So he must also be nearing us. You are lucky that you have got some kind of succession plan there, isn't it? Well, what about the others? When a principal, you are the one to tell the Vice Chancellor all these things. And I don't think you have been bold enough, because the Vice Chancellor is a very good man, and he has it's like the president who has a big basket. If you don't put your priority properly, then he passes you and goes to the next one. You see, you can never tell until you get there. When I was doing community health, I won't tell you when, because you will laugh at my age. It was Professor Hampano Usu, the late Professor Hampano Usu, described epidemiology as the distribution, deterrence, determinants of disease and disease patterns in human population. That's a lot of grammar about what we are going to do here today. And the disease is basically COVID-19. And I'm glad you have said data, but one word you have not said. Huh? It has to be genuine data. Yeah, and this is what this university is known for. Because from where I sit as the policy director in the ministry, I see all sorts of data. And when you test them, they don't exist. So as you talk about data and data is power, and data is knowledge, and data can be used to build or to destroy. And I also wanted to ask the two leaders whether they have taken care of the intellectual property aspects of this data, because there's no beauty in generating excellent data that is being used elsewhere and you are not benefiting from it here. And I'm not talking about COVID, because for COVID, there is no intellectual property. In fact, those people who are charging for the vaccine, in my view, should be arrested and jailed, because this is something that is killing everybody. Why do you want to make money from it? Are we together here? So I'm very happy to be back at home and to say that this university, this is one of the identities of this university. It's the College of Health Sciences, which has now got subdivided into various other components, which each of which is important, along with the College of Veterinary and the fact that we train vets, the fact that we train pharmacists, the fact that we train engineers, which was the original citadel. That's what defines this university, and lawyers. But you know now, excuse me please, everybody is training a lawyer. So the question the university has to ask Professor Kiama, you have the strongest faculty again in the training of lawyers with over 50 PhDs. How is university benefiting from them? I was in Jomo Kenyatta the other day, and they have an excellent engineering department. I was telling them, okay, this building, you have spent 69 million giving it to a contractor. If you are doing what you should be doing, you should have done it yourselves. It's just labor, because all the professional work is done by you. Why are you wasting? You would have saved maybe 30 million shillings, some of which the university can allow you to take maybe 10 million to divide among yourselves. You get an excellent building, and you have saved the university another 25 million. That's the only way you are going to survive, Professor Kema. So if you have capacity to enlarge the School of Medicine, because everybody applies to come here, what are you waiting for? You expand the buildings, expand the faculty, only retire the dead woods. Who are my colleagues who now cannot think seamlessly as professors do. But as long as a professor is thinking seamlessly and doing his work, when you let them go, they are going to be a competitor. And the net effect of that one will be that in about 10 years, we shall have lost our advantage, which God gave us, because these people were not there before. It was God-given. So I'm so happy to see that there's a new center for epidemiological modeling and analysis. The research output, Bwana Principal, you also did not tell us, you know, this was a show, because Jeff Koinange is here. You should have said, over the past 12 months, this college has produced original research number X as compared to all the others in the country, because you can't compare with one. This is it. The people don't know. People don't know. And like I say, the Google Scholar platform is there. You can check people like Jaoko. Umwanzala is not here. Most of these people who are doing actual research. And so this college is so important for the university, where the university is, among others. And I think if you have children, the first child is not so bright. Second one is not so bright, but the third one is very bright. You will be a fool not to ensure that this third one that is bright is brought up so that people can see you. So the performance contracting, and I'm glad to tell you that my ministry again was ahead of the others. I'm not bragging, but this is true. It was not because of anything, but when you do something consistently, again and again and again. For example, the issue of time. If you keep coming to work at 6:30 every morning for 2 years, and your staff follow you, it will show in the performance contract. If you keep coming at 10, it will also show. So there is nothing magical. And I think the university is in a very good pedestal with very good leadership. I just hope that more of these centers can be created. But the red light is because I think you have an aging faculty, an excellent but aging faculty. Even if you ring fence them, there must be a succession plan for this. Otherwise, everything we are doing is going to be futile. You will escape it even if you do 10 years, but immediately after you, this college will have gone to the dogs because all the old people, even if you look for Kinotieno, they will not even be seeing, they'll be blind. So, so we have to have a vibrant plan that will make sure we have a reasonable succession plan. From where I sit, as I sit down, Honorable Vice Chancellor, in my view, we can increase the number of students here by up to 50%. And you will still get creme de la creme. They will come. Question is, will you have enough faculty and the capacity? Capacity is now neither here nor there because COVID has told us that virtual training is so important, is possible, except in the clinical areas where you must go where the rubber meets the road. You can't train doctors for us who have been trained virtually. Are they going to do clinics virtually, to do operation virtually? So these are areas. I hope your managers are giving you these challenges because this is one of the colleges that you can expand so that, like, if you grow the research money to 10 billion, and from that 10 billion, you take 15%, that's 1.5 billion, which is a significant percentage of what we give you. Which university will do that? That's it. And I hope that the people we trained to write proposals and take them to the world, your type, I hope you have recruited others and you are still doing the same. That's it. Do you understand what I'm talking about? So I'm very glad to have been here. I couldn't have said no, even though I was very busy. I will always remain tribalistic as long as this university is concerned. With masks, I'm not able to know everybody now. The mask will camouflage. Otieno has a bad head, so I can also see. But otherwise, I wish you all the very best in this process and to continue to maintain the standards. But Vice Chancellor, you have kept on the principle, you have kept the ambience of this. This is 20 years without repair. We put this to over 20 years ago, actually 21 years ago. And it then shows that here, there are many things we do that people don't know. We also maintain government facilities to look as if they are private, and sometimes even better than private. Thank you very much.
Wonderful remarks there, Professor. Really, really well done. And please feel at home. This is your home. I feel there are a lot of big brains in this room here. I feel very small today. And the names you're mentioning and the stuff they have done, and SEMA now is a trendsetter. So I'm very proud to be associated with this people, with this room, with this university. And it's good to see you too, Professor. I always see you on TV for some reason. As you all know, the Cabinet Secretary, ICT, my friend Joe Mosher, was supposed to be here to give his remarks because there's a relation between ICT and this unit. But he was with the president in Ethiopia doing some very important work, exporting our businesses to Ethiopia, in particular Safaricom. So here, on his behalf, I'd like to invite Maureen Barker. She's Chief Administrative Secretary, Ministry of ICT. Give us a few remarks.
Thank you. Professor George Magoha, the Cabinet Secretary, Ministry of Education. Dr. Amoth, Director General, Health. Professor Kiama, the Vice Chair, University of Nairobi. Professor Mwangi, Infectious Disease Epidemiologist at the University of Nairobi. Dr. Ombajo, Head of Infectious Disease, Unit at Kenyatta National Hospital, and I've had senior lecturer, Dr. Shiko Gitau, renowned computer scientist and Color CEO. Ladies and gentlemen, good morning. Thank you very much for the opportunity to join you all today for these key discussions during the official launch of SEMA here at the University of Nairobi Institute of Tropical and Infectious Diseases, College of Health Services. I'm informed that SEMA is a national community of practice based at the University of Nairobi, bringing together a collective of specialists from multiple disciplines drawn from academia, private sector, and government to develop tools and models that aid in the collecting, analysis, and visualizing of health information gathered from national population data. I am further informed that SEMA's multidisciplinary team uses data from various sources to track disease trends, which has been key in understanding the COVID-19 pandemic and informing policy decisions in Kenya. I greatly appreciate the positive contributions that the center is making in the ongoing efforts to manage and control the COVID-19 pandemic. I note that SEMA has been pivotal in informing the government's COVID-19 response and policies. Since March 2020, the SEMA team has analyzed the COVID-19 situation in Kenya by looking at the positive cases, the testing rate, the positivity rate, and the availability of hospital beds in the country against our health personnel, and has informed policy decisions to manage the pandemic. There is no doubt that the pandemic has greatly affected businesses and indeed all sectors of the global economy. The crisis has brought a greater appreciation of the role of technology and innovations in meeting the demands of today's challenges. Indeed, the ICT sector has become a key enabler of the recovery efforts being put in place to get economies humming again. The silver lining has been the acceleration of the adoption of digital and tech solutions in almost all sectors of the economy, with delivery platform services providing a lifeline for the circulation of goods and services during this period. We also acknowledge the work of the talented ICT staff who have kept these digital platforms highly available and secure amidst a global increase in cyber threats, and encourage them to keep innovating and developing new products and services that meet the ever-growing demands of a digitally engaged populace. So today, I want to congratulate the partnership of SEMA for its agility, for its steadfast dedication to making available clear and reliable data that ultimately saved many lives in the early days of the COVID-19 pandemic. They could have sat back and joined the ranks of what we call Twitter warriors, criticizing the government's efforts. Instead, they got involved, provided concrete solutions, and made a visible impact. That is to be congratulated. The Kenya government, under the leadership of His Excellency, the Honorable President Uhuru Kenyatta, is committed in ensuring that Kenya as a country is at the forefront of the fourth industrial revolution. To achieve the Big Four agenda, technology is and continues to be indispensable in its achievement, and it is in this perspective that the Ministry of ICT, Innovation and Youth Affairs comes into play a key role in facilitating and supporting the deployment of technologies to accelerate the progress towards the achievement of this agenda. Adoption of new technologies and sustained innovation are imperative in order to secure a strong future in the digital economy. The delivery sector needs to build on its vast network for enhanced last mile deliveries, latching on the momentum created by the COVID-19 pandemic. The government is also keen on playing an active role by developing a robust policy, legal and regulatory framework to accelerate the digital transformation of the country and spur growth in the technology sector. It is also not lost to us the need to develop digital skills and competencies that will support this new environment that we are creating in order to support our national development goals through the digital economy. I wish to acknowledge the technological innovators, Kala, what they have brought to SEMA, the private sector partners, without whose participation this partnership would not have been possible. This includes Amazon Web Services, who provided free web hosting services, the different tech companies, including Facebook, Google, Uber, and Bolt, who provided complementary mobility data to enable the modeling work. Ladies and gentlemen, allow me to briefly outline on how data and ICT is being used to drive the health sector towards the realization of the Big Four agenda. We do have in place the ICT master plan, the ICT policy, which are all aimed at guiding the country on the footpath towards becoming a global ICT leader. Further, we are fast tracking the finalization of the digital economy strategy for Kenya. We are also in the process of placing in operation the Data Protection and Privacy Act, as the Act and Office of Data Commissioner is already in place. Konza Technopolis horizontal infrastructure is completed at 45%, and the project is expected to be a model smart city and innovation hub for Kenya and the region upon its completion. We do have in place the digital literacy program to impart digital skills in schools, and implementation of phase 2 is ongoing. Further, the government has 1.08 terabyte capacity for its use on the Thames submarine cable. Over the years, this capacity has remained underutilized. Hence, the government is investing in building a transmission network from Mombasa to Nairobi through Konza. We continue to ramp up connectivity across the country by increasing access in the underserved areas through the Universal Service Fund. We also work with the National Government Constituency Development Fund Board to establish constituency innovation hubs to avail ICT infrastructure closer to people, particularly the youth. Through the Ajira Digital Program, these centers are being branded, put in operation, and staffed. The Ajira Digital Portal also gives the youth the opportunity to learn digital skills, as well as access digital jobs as a means of creating meaningful employment and improving lives. All these, plus a myriad of other industrial and commercial applications backed by our innovative aptitude, means that Kenya will be at the forefront of the fourth industrial revolution. Last month, together with Safaricom Limited, Ericsson, and Huawei, the Ministry of ICT launched the 5G technology, which is currently being piloted in Nairobi and Kisumu. The Ministry of Health intends to roll out universal health coverage, thus necessitating automation of most of its business processes. There is therefore an urgent requirement for all hospitals to be provided with connectivity to facilitate online and real-time data management. To date, connectivity to 18 level 4 hospitals under UHC has been done countrywide by the Ministry of ICT, with deployment of IP telephony targeted for phase 2. I wish to reiterate the government's commitment in promoting an effective ecosystem that supports the development of the digital economy. Lastly, I call upon all the players in this space to explore the available opportunities to develop new products and add value to existing products in order to build momentum towards a vibrant e-commerce ecosystem in Kenya. By making data easy to understand and easily accessible, the SEMA partnership affirms the citizens' right to information entrenched in our Constitution. This is the deepening of democracy made reality through digital tools. We are glad to have been a part of it, and we look forward to incorporating data from other sectors pivotal to the Big Four agenda. With that, I thank you, and I wish you all the very best. Asante.
Maureen Barker, wonderful words. Thank you so much. You're probably the only other person in this room apart from me without a title to their name. So Maureen, you and I, we are together. Said big brains in this room, big brains. Speaking of which, ladies and gentlemen, what is SEMA all about? Sure, some of you may be wondering, and wonder no more, because I'd like you to direct your attention to the both screens in front of you. We'll have a short documentary on the Center for Epidemiological Modeling and Analysis. Take a look. Remember, Ministry of ICT is here, okay? So no pressure, no pressure.
When COVID-19 was first announced in Kenya in March 2020, the country was highly reliant on WHO data and by observing the infection rates in other countries. In the last year, data has become one of the most valuable assets in Kenya and the rest of the world. Information technology and data management have become intricately linked as countries make decisions from locally generated data on how to manage COVID-19 better. Schools closed, movement restrictions were put in place to reduce the spread of the new virus and to allow the country to prepare. There were a series of government actions that will flatten and delay the curve. In June, there was a new kid on the block, a much needed one. The Center for Epidemiological Modeling and Analysis, SEMA.
So when you're faced with a public health emergency like what COVID-19 has done, every day is a learning day, and you have to make a big decision as to should you close schools, should you open them. You have to make decisions as to who should be tested, should people be allowed to move freely, when should you stop movement, and those kind of decisions are huge. You can either use expert knowledge or you can simulate those situations within models, which we refer to as mathematical models or epidemiological models.
A team of local health experts came together to bring all the COVID-19 data under one roof. The need for local solutions for a global problem brought together epidemiologists, infectious disease specialists, clinicians, mathematicians, statisticians, computer scientists and data scientists to analyze the trend and inform policy on better COVID-19 management.
The idea of SEMA is to harness the existing health data and make better decisions. So the critical thing that we want to address here is both the speed and the quality of decision making in health using data.
The other focus areas around research in infectious disease, and this would be clinical research, population research, how various infectious diseases affect population, and factors within the population that affect infectious disease. So that's another core area, one of our focus areas. So when we collect data from the patients that we see, that then helps inform some of the models, some of the practices and data that ends up being analyzed. So if I give you an example, early on in the outbreak, we looked at all the patients who were coming in. What age groups were they? Who are the ones who are likely to get very sick? Who are the ones who are dying? When we come to modeling, there are certain parameters that we have to input into these models, so that you want to say, if we look at Kenya, how many people are of this age group that are likely to die? You see, that's data that we've gotten from our clinical work. So that is how the clinical work then translates to the data that is used for modeling and the rest. Similarly, we have issues like patients come in COVID positive. When do they turn negative? What happens before they turn negative? Do they transmit to other people? So those are also questions that you can answer from some of the clinical work. And that's sort of that data that we collect from the clinical work helps to inform the bigger field of analytics and modeling.
The issue of health from old times, everybody just talks and is an expert. Everybody saying this, oh, we have a lot of communicable diseases, we have a lot of non-communicable diseases. You saw even with the issue of the COVID, even people were not breathing whatever information that was being given initially. Perhaps because there was the issue of what is the source of this data. As a university, we have the appropriate convening power. We have the credibility that when we correct this data using our well-trained scholars, the professors here, that this data, when we give it, because even the way we analyze it, is going to be credible and therefore is going to be very usable or very relevant to make decisions, including decisions on where we need to put our resources when we are taking care of the health of our people.
At SEMA, young people are playing a critical role by acquiring data literacy. This ranges from data wrangling, visualization to technical roles such as connecting mathematics, biology, and epidemiology to stimulating and answering the what-if scientific questions. The Center for Epidemiological Modeling and Analysis, SEMA, will also train health workers and postgraduate fellows through short courses that will enhance a better understanding on how to translate data insights into policies that improve public health.
SEMA promises to, bring on board people, faculty who are very experienced in managing of data and data analysis and modeling. And these experienced faculty will be working closely with the fellows, the young, fellows who are going to join the center, to mentor them so that they can become researchers that will be useful in fighting emerging infectious diseases.
We get the data, we clean, and we visualize it. Mostly we use graphs and maps so that it's easier to understand the burden of the disease in the public and hence inform decision-making to help prevent the disease.
Kenya needs experts to take charge to provide its own sources of information and data to solve their public health issues. We need homegrown solutions.
We will avail the center for short courses, for many people to come and learn and be mentored to be able to support the health systems in this country. So many people will be generated there with fellowships, with masters and PhD. Because the future of managing health is data. Is data, is data. And SEMA is coming to fill in that gap.
I'm registered as a PhD student with University of Nairobi and specifically at the SEMA Institute. So that's where I'm currently doing my PhD studies and specifically focusing on mathematical modeling of COVID-19, trying to understand the control, the transmission, the spread of the disease within Kenya. The sort of data that we collect from the county and even as far below as the sub-county level is cases, line lists of what we call a case line list. And these are cases of people who have tested positive for COVID-19. After we get that, based on the testing, that is transmitted to the national level. And then those cases or that data also essentially is supposed to help us to do contact tracing, to be able to map out where the contacts of the positive cases are and to be able to trace them and isolate or quarantine or isolate them to be able to break the chain of transmission of the virus.
So for me, the most important thing, exciting part of this last year of SEMA has been working with extremely young people on data, and some of them we got from the university. The School of Computing gave us some students to come get embedded into Kala. So they have this academic responsibility for themselves because most of them, two of them were finishing their masters, and but they also have to deliver from a private sector angle. So they were giving us the the rigor that comes from academia, but also on the other hand, we were pushing them from a private sector point of view. And if we can do more of this, get that private sector industrial perspective and experience while the students are still students, hopefully some of that agility will be injected into how things are doing.
It's exciting to see that women are coming at the forefront, especially in science when it comes to decision making, because they're bringing in the voice of women, which for a long time has mainly been one-sided and fled by the men.
The data from SEMA has been used to make policy decisions and enhance the health protocol measures to control the spread of COVID-19 disease.
Managing patients, writing guidelines for patient care, writing guidelines for prevention and management of disease. And that's a lot of what we've done over the last year or so as regards COVID. But we also put a face to numbers. Sometimes numbers seem very remote. It's just we're announcing these figures, but who are those people who are making up these numbers? What are their characteristics? How do they present? How do we manage them? What are the outcomes? Who dies? Who does well? Who does poorly? That is data we can only get from our clinical work.
And at the school, we provide training. We also do research and also do a lot of extension work also. Part of that extension work includes working with the Ministry of Health. This is through the university's business arm. This is UNES. And with the Ministry of Health, we provide technical assistance in the area of health and health information systems, largely making sure that the data that is required in health comes in. We take care and support the systems that are used to do a bit of the data capture and also the data collection, and also some of the data repositories.
SEMA is about real-time decision making during public health crisis. It's about the speed and the quality of those decisions. SEMA is about using local data to inform decisions in policy that improve public health.
I think that deserves a round of applause. Yeah, absolutely. Absolutely. Well done. Very, very good. At this point, we're actually going to have a panel discussion, but because of time, I have placed several mics on a couple of the tables, and I'll just directly ask some questions, maybe one question each, and then we can move on to the next part, just for the sake of time, if you don't mind. Ladies and gentlemen, doctors and professors and other professors. Let me start with CS Education, Professor George McCall. You're coming home. You said yourself, it's like coming home. How does it feel coming back home and seeing what your colleagues, the people you left here, what they've achieved? How does it make you feel, sir?
Thank you very much, Jeff. Thank you very much, Jeff. It is satisfying to come back to this college. It's like I joined this college in 1988 as a lecturer and grew through the ranks to what you now know, and went through all the administrative levels. But the important thing is I left the college in 2002 to go and manage the main university, and I have seen growth. First of all, the things that we did while I was here have been maintained in a manner that only doctors can maintain. You can see for yourself that this building, no, look at the woodwork in the walls. Look at the floor. The offices, I hope they have taken you to their offices upstairs. The expansion, I think the most important thing we did here was to get that lab that is the level 3 lab that is being headed by, what is it called now? Huh? The United lab. We went to Canada, negotiated the money, and the lab was built. But after that, many others. There are many good researchers. Some of them are not even here, from pediatrics and from elsewhere, the Ruth Ndwatis of this world. They have continued, Jeff, to ensure that this college is growing, and that I hope that even the effect of COVID-19 is not going to shake it, because they have capacity People keep on crying, oh, we need research money from government. These guys don't care. They go for the research money outside there in the world. We formed research syndicates headed by the likes of Professor Jaokohia, Omwanzala, and others. And they go and fight for the money out there with other universities, and they come, and you have heard they are renovating the university at no cost to the Vice Chancellor. So the only thing that was not clear is whether they are giving the Vice Chancellor the 15% that they require, that he requires is administrative to help him to run. So others, I'm extremely happy to belong. And when I stop being a minister, this will be my first call to come back to ensure that we can still contribute. I thank you very much.
Thank you. Dr. Patrick Amoth, and congratulations for your appointment as chairman of the executive board of WHO. I know we're always giving you a hard time when you come on TV. Always a hard time. You know, we always tell you the numbers don't add up. The numbers don't add up. You know, we're the first to tell you that. But looking around, looking at what SEMA has done, your thoughts, what can you turn around and tell us, the doubting Thomases, when it comes to those numbers?
Thanks, Jeff. I think SEMA has done a great job in helping the Ministry of Health craft the interventions, especially the advisories, based on locally generated data. I think as previous speakers talked, you remember initially in the early phase of the pandemic, we relied on data, especially from China and from the WHO. And remember the socio-cultural characteristics of these people is different, their behavior pattern is different. So you could not directly infer that whatever was happening in China would happen in Kenya. And that is when we thought out of the box to be able to bring our great academicians on board to be able to help us in terms of looking at the data, analyze the data so that we can be able to craft interventions that will apply to our local population. And that has worked extremely well. Regrettably, of course, we have lost lives, but the measures that we have put in place have saved thousands of lives. And we continue to applaud this relationship between the Ministry of Health and SEMA. And we look forward to building it further, not only in the area of COVID, but in all other areas, because in this area, in this era and age, you have to practice evidence-based medicine. And that can only be informed by data. This data is what is going to inform you in terms of policies, in terms of the interventions that you are going to craft. Thank you.
Thank you, Doctor. Dr. Shiko Guitar, let me ask you this. 14 months later, after the first case of COVID-19, if it wasn't for data analytics, if it wasn't for a center like this, where would we be?
So I remember can you hear me? Okay. I remember in April of last year, we had this headline, in March, it's 10,000 cases by April. And I remember we were sitting down with Thumbi to think, is this the right thing you want to feed? But the shock therapy actually worked. When people saw 10,000 cases by April, people got their act together. The government got its act together. The people on the ground got their act together, and people started wearing masks, cleaning their hands, sitting at home. And there's a paper that came out, I think, end of last year, that showed that the measures that many African governments, including Kenya, that put on earlier on, is what saved the pandemic from spreading the way it could have been. I always joke that I got COVID in October, and the tablet I was given was written COVID medicine. If I'd gotten it in April, there would be no COVID medicine to be talking about. It would be just using like a concoction of different types of medicine, just experiment on people's lives. So for me, it is many lives, as Dr. Amoth has said, many lives changed. And I'm glad that you were here to respond to that.
Very well said. Did you get your second jab, by the way? So you're frontline. Oh, wow. So you're like us, sort of. Thank you, Dr. Guitar. Great job, great job. Dr. Thumbi, I saw you in that documentary there, and you were talking about real-time decision-making. Dr. Thumbi, see there, right? That's what SEMA is all about. is this what it's come to? We can able to tell or make decisions in real time because of data. There's something wrong with that. We can't hear. Go on.
Yeah, when you've got a big pandemic like the one you've been experiencing, we have no luxury of time to make decisions 3 months down the line. I think the really critical thing is that we have got a team of extremely agile young people and ourselves with the right appropriate expertise, that we are able to make decisions based on analysis that is done overnight. So Dr. Ahmad will call us and say, we do need to meet tomorrow, and we can spend the whole night running models. So as when we meet, we are not talking about guesswork. We are talking about the best simulated what-if scenarios of what would happen. So I do see this real-time decision-making that is now institutionalized within SEMA as a really critical thing for this country.
I always like to save the best for last. Dr. Lois Ombajo, very familiar face on our show. Look, there are a lot of critics from day one, and like Dr. Guitar just said, you know, there were numbers that were put out there, people got really scared. Oops, some feedback there. Is it those mics? Yeah. Thank you. A lot of critics, but then you and your team, everyone in this room has managed to stay ahead of the curve, if you will, like literally staying ahead of the curve. Is that what we're doing? Can we still keep on? Even the pandemic is not going away anytime soon. I mean, we're hearing third wave, fourth wave, etc. Can we still stay ahead of the curve with SEMA?
Thanks, Jeff. I think one of the lessons we've learned with COVID is that we didn't know very much. And every time something else happens, we realize just how much we have to learn. And I think staying ahead of the curve really means that we must have real-time data to inform what we do, but that people have to do the things they're meant to do. If we all wore masks, for example, as we went out there, then we'd stay ahead of the curve no matter what variant comes on board or no matter what new respiratory infection comes on board. So other than having the data to inform what we do, we must then do the right thing. And I think our call to Kenyans has always been, there are things we can do to prevent those figures that have been modeled or projected. So that when we say 10,000 or 100,000 in so much time, there's something we can do to change that figure. So it's really about what people do and how we prepare. I guess one of the things we've worked with Ministry of Health, and we keep pushing Ministry of Health on this, is how prepared are health facilities to handle. Because as the numbers come, people also die, and we must do something to change those numbers.
Absolutely. At the end of the day, it boils down to us individually. Keep that mask on, wash your hands, sanitize, social distance, all that basic stuff. You keep saying that, and you're right. Okay, folks, I would love to continue this conversation, but I know time is of the essence. So I'd just like to invite on stage for his few remarks, Dr. Patrick Amoth. He's the Director General, Ministry of Health. He's also new chairman of the Executive Board of WHO. For his few remarks. Karibu, sir.
Thanks, Jeff. First of all, allow me to convey the apologies of my principal secretary. Professor George Makoha, Chief Administrative Secretary, Ministry of ICT, Madam Maureen Baka, the Vice Chancellor, University of Nairobi, Professor Stephen Kiama-Gitai, senior academic staff of the University of Nairobi present here, our colleagues from the Fourth Estate, distinguished guests, ladies and gentlemen, good afternoon. I wish to appreciate our host, the University of Nairobi, for their hospitality and express my honor to be here today to commemorate this important milestone, the launch of the Center for Epidemiological Modeling and Analysis, SEMA. SEMA's aim of supporting the control, elimination, and eradication of infectious diseases through data-driven decision-making is timely due to the emerging need for data to inform the Ministry of Health's interventions in the face of the COVID-19 pandemic and in improving health of Kenyans. We are all aware that public health emergencies call for rapid and focused responses to avoid overwhelming the health systems and to save lives. And you saw what happened in the month of March when our health systems were stretched to the limit and nearly buckled at the rising number of cases. Indeed, the most successful national responses globally in the context of the COVID-19 pandemic were most effective where decision-making was timely and clear, where there was capacity to coordinate efforts across multiple sectors, and where the formal advisory structures were able to provide timely scientific advice that was needed. And this was clearly exemplified by the formation of, by His Excellency, the President of the National Emergency Response Committee, which brought the whole of government, whole of society, of this group of leaders, scientists to be able to craft and discuss with other technical people, including SEMA, in terms of the advisories based on locally generated data to be able to inform the decisions going forward. As a country, we have seen the value of science in managing the pandemic, and we will stick with science till we overcome the pandemic. At the beginning of the COVID-19 outbreak, experts from the University of Nairobi and other institutions were called upon to offer critical support to the Ministry of Health and the government in crafting an appropriate national response to the pandemic, a role that they have continued to play to date as the pandemic has evolved. And they have continued to play this role pro bono without any payment, and I applaud you for that. The team was incorporated into the National COVID-19 Response Task Force and various thematic committees and offered support on COVID-19 modeling projections, crafting advisories on appropriate mitigation measures, and public education through various public media channels. It is notable, ladies and gentlemen, that the University of Nairobi Institute of Infectious Diseases team continue to provide to healthcare workers around the country with the information on patient management, and this has led to better outcomes through the weekly webinars that brought together healthcare practitioners from across the country to review their challenges, successes, experiences, and innovations in healthcare provision for COVID-19 patients. Some of these webinars have drawn crowds to the tune of thousands. And I think it's every Friday, I think from 10 or 11 to noon, the entire healthcare workforce of this country is glued to the webinars, learning new and emerging things regarding COVID-19. And that has led to better outcome in terms of case management, both at the facility level and also home-based care and isolation facilities. I sincerely want to thank the team for this initiative. This support was enabled by various factors that were identified by the ministry as strengths within the University of Nairobi to become the institution's contribution towards containment of the pandemic, including expertise in data analysis and modeling, availability of real-time data on COVID-19 cases, and close collaboration between the ministry and the rest of the modeling teams. Ladies and gentlemen, the ministry is proud to be associated with the University of Nairobi Center for Epidemiological Modeling and Analysis, which has been a critical partner to the government in protecting the health of Kenyans in this unprecedented public health emergency. As we launch this center, we look forward to a continued close collaboration as we continue to fight the pandemic that threatens the lives and livelihoods of our people. We look forward to this Ministry of Health, University of Nairobi SEMA partnership in preventing and controlling other infectious diseases, as well as the impact of infectious diseases on other health outcomes. We recognize that COVID-19 is not going to be our last pandemic and acknowledge with concern the threat posed by other emerging health issues such as antimicrobial resistance. Ladies and gentlemen, I wish to recognize the co-founders of SEMA, Dr. Umbajo and Professor Thumbi and their collaborators, who continue to work closely with the ministry through the Director General's office and have been available at very short notice and heeded every call that the Ministry of Health has made for support in managing this pandemic, a true sign of patriotism. I am confident that this team will see the collaboration between the Ministry of Health and the University of Nairobi and the SEMA grow to greater heights. Finally, ladies and gentlemen, it is now my honor and pleasure to launch the Center for Epidemiological Modeling and Analysis at the University of Nairobi to improve Africa's health through data, a vision that Kenya has begun to realize. Thank you.
Thank you, Dr. Moth. Well done. Well done. And love it. I mean, it must have been your principles or your discipline, Professor Makoha, because this thing is on time. Started on time. It's going to end on time. That's what you say when you say you get to work at 6 a.m. That's it. It's discipline. I appreciate it. And by the way, we're all going to go and observe this SEMA Data Science Lab. We're all going to go across. But because of COVID-19 regulations, only the following people can go into the room. The rest can go after, if you don't mind. Okay, so this is the list I've been given. Do not crucify me if you're not on this list. Cabinet Secretary Magoha will be there, of course. CAS, Mbaka, you're there. Vice Chancellor Kiama, also. DG Moth, please be there. Principal Mashoki, Dr. Maengo, excuse me, Professor Amoyo, Dr. Shiko, Professor Jaoko, Professor CF Otieno, Professor Waiganjo, Professor Thumbi, Dr. Lois Ombajo. Those folks will be allowed upstairs to observe the first part, and then everyone else can go after that. But there are cocktails for everybody, and we'll be going for cocktails. Before we do that, I think it's only fair for a moment like this, an event like this, to have what we call a photo opportunity. So all the special guests, these two tables, please come forward, and the photographers can take a nice quick picture of you all to mark this auspicious and historic occasion. And then after that, we'll walk over. So please, ladies and gentlemen, professors, doctors. Thank you. Thank you very much. Oh, by the way, those who are going to stay in the room, the event downstairs will be streamed live on these screens. So don't worry, you won't miss a thing. All right, shall we? Yes.
Yes, we are not finalized.
You see, so what I'm talking is the two of you will hold this scissors, and I'll show you where to go and just cut, and then everyone else can follow right after that. Because it's such a tight space, it's just the two of you can cut it together, okay? And you will see it just here, just okay, come. Look. Oh yeah. There you go. Ah, yes, yes. Whenever you're ready, just cut it. Excellent. Done.
of Health, because often they have to run after people doing surveys and studies to access some of this data. So that's one of the things that we've done. We're still hoping that the COVID study will work, but I think it's a little slow. So we can go on, so we will also show something and we can get back to this.
So one of the key things. And they had 112 applicants. They were all needed to write a proposal and see how they can spend about £5,000, and they compete for that money. And as you can see, the applicants, and you only wanted people from East Africa, we got 112 applicants from across the region. And ladies were 30% of that, and gentlemen were 70% of that. And they came from all kinds of sectors, from NGOs to universities, to the ministries of health, and they're interested in many different things, from COVID-19, which obviously is the biggest thing at the moment, to tuberculosis, rabies, HIV. And we went through that whole process of interviewing them and came up with 13 of them that we shall be providing the fellowships with, and that's five female and 8 males. And they come from the country that you're interested in, which is part of the region. And the message out of this is
Gapi from here.
Yes. This was competitive. So and we allowed different compete well, and it's true.
Yeah.
We got more of Kenyans.
Thank you.
And the idea is to create this kind of opportunities, not only for people in academia, but also for people working like with Dr. Ahmad at the ministry. So we can pick someone, say, from vaccine and spend with them 8 to 9 months and teach them through how to work with data. And when they go back to their ministries, obviously, they're going to be really important for this nation.
Thanks. So one of the things, you want?
Reload.
It's taking long to reload. Okay, the internet is slow, but we are lucky because our VC is here. We look at issues of internet. And for Professor Magoha, there's one thing I want to mention. Some of this work, you lauded the issue of bringing in funding from outside of the country. Some of the initial work we did was indeed funded by an international donor, the Bill and Melinda Gates Foundation. And yes, we gave the university 15%. But now we also want governments to fund some of our local work.
We shall do our best.
We are reaching to you so that the National Research Fund begins to put money into initiatives such as this.
I'll look for you and we shall have a talk with them. So.
Oh, thank you very much.
Yeah.
So one of the other things we do is tracking trends. When a pandemic such as COVID-19 comes, sometimes it's very possible to forget other health issues in the country because all attention is focused on COVID-19. And one of the things that we have the ministry do was to keep a track on what else is happening with other health indicators. So for example, here, she got an indicator for facility attendance. So you look at this line just indicating different years. So this is, the light blue one is 2018. Then this light green one is 2020. So when COVID came in March, you can imagine what happened to health outcomes. One, people stopped going into hospitals because, because they were scared of health facilities. Transport was interrupted because of the restrictions. So outpatient attendance went down significantly. What does that do for health outcomes? It means people with chronic illnesses are not taking their medication, they're getting worse at home, and some may die because they're not accessing healthcare. So by helping the ministry keep a track of what's happening with other indicators, they're able to put in mitigation measures. So for example, when Dr. Ahmad saw this, he then sent out an advisory to hospitals that you need to continue with chronic care. You need to open up clinics, you need to start doing surgeries so that we do not lose people as we take care of COVID. So thank you very much. That was just a brief showcase of something.
And VC and Dr. Ma, they just want you here just for a quick photo in front of the screen, and then we're done. Then we're done. And go for coffee. And Dr. Kumbi, yeah. Quick photo.
Yeah, interactive. Thank you.
Okay, so here what we're looking at is keeping a track of health trends over time. So for example, one of the things that we want to look at data for hospital attendance is that as COVID started, people stopped or reduced significantly the number of people who are sick and stay in hospital. And that has an impact on other health outcomes outside of COVID. So this is some of the work we're doing of what happens in health.
Thank you.
So now, because of the significant support that we intend to give to the Ministry of Health, we have an agreement that has been crafted by the University of Nairobi and the Ministry of Health, and we kindly ask Professor Kiama and Dr. Ahmed to sit at that end so that they can sign this agreement.
I mean, a group photo. Group photo, okay. Okay. There you go. 1, 2, 2.
After this, there's a cake cutting ceremony downstairs. So the cocktails off. We make our way downstairs and we're done.
Connect to the board.
Excellent. We will continue to support the ministry. Thank you very much. Thank you. So the University of Nairobi will continue supporting the ministry. Memorandum of collaboration agreement.
When COVID-19 was first announced in Kenya in March 2020, the country was highly reliant on WHO data and by observing the infection rates in other countries. In the last year, data has become one of the most valuable assets.